It was just a journey for me. I wanted to feel a little bit more confident in my clothes. After having one son, I didn't like the fupa, you would call it. So I just wanted my body contoured a little bit more, and it was a great choice.
Actually, it's been a thought of mine since I had my last child, and that was 14 years ago. So I've been researching and doing things ever since to get me here. It happened to be that I'm in a place in my life that I was financially able to do it, and I just wanted my body back. And I think the doctors have done such a wonderful job that I feel like I finally got my dream back.
Well, I had a health scare earlier in the year that everything turned out okay with, but it put a lot of things into perspective for me. And I realized that with life being so short, it is too short to be living unhappy in the bodies that we have. So I went to researching different things and seeing what would be doable for me price-wise. When I came across premium care, I actually didn't know that you folks were located in Colombia. So I had watched a couple of YouTube videos and seen the work that was there, and that Drs. Campbell and Restrepo were both working together, and thought that wouldn't possibly be something that I could afford. And then after going through and getting the breakdown, it was definitely something that is doable.
Just to build up my self-esteem. It was really like for me, not for other people. I just wanted to make some improvements.
I decided to have plastic surgery for two reasons. One, I lost 150 pounds, so I did have a lot of excess skin. When I first lost the weight, I had a surgery from where I'm from, and my doctor just removed the excess skin, but the way he cut me was way too high on one end, so I had a fat pouch that just kind of hung over my clothes. So I definitely wanted to get a revision surgery for that, to fix it to where, you know, I don't have to wear a shaper in order for you not to see, you know, I guess you can call it a muffin top, really when it really wasn't, but for you not to see those areas that were protruding.
Well, that's a good question. Well, I think that when you want to look better in yourself, and you want to feel comfortable with your person, that's why I choose premium care for that.
Oh, sure. Well, my journey started over 3 years ago. About 3 years ago, I just decided I was really unhealthy. I had gained a lot of weight. I had finally decided I was going to die if I stayed on that path. So I finally went and saw a doctor, got weighed for the first time in quite some time, and I was up to 349 pounds. And went and saw a nutritionist, did some counseling, basically took everything science had to help me start losing some weight. I lost some weight, and then I had a gastric sleeve and lost more weight, and I was down 140, 150 pounds, but my weight loss had stabilized, and I was really pretty happy with how much weight I had lost. You know, could lose a little bit more, but felt pretty good about it. Was healthy, could move, do the things I wanted to do. But I was left with basically the skin bag to hold an extra 150-pound person inside my body. I didn't want to do that. So it made sense to start thinking about how to get rid of all that excess skin, because I just didn't want to carry it around anymore. It was hard to put inside clothes. My arms hung out of shirts. I never felt bad about myself. I didn't feel ugly. I just felt uncomfortable. I felt like I was just being held back from doing the things I wanted to do. So, started investigating. I've been thinking about this for, oh gosh, I knew that the skin removal was going to happen when I decided to have the bariatric surgery. That just kind of, you can't lose that much weight that fast, especially at my age. It's just not going to snap back. So I knew it was going to happen eventually. Maybe 6-8 months ago, I started researching it a little bit more heavily, and then at work I very seldom have kind of open opportunities to be out of the office for an extended period. I have a pretty intense job, and just the stars aligned. I was able to be out of work for a little while, and my boss was, I talked to my boss about it, and he said, yeah, if you can get in and get it done basically now. And so, I called, and you guys just happened to have an opening, and you know, I'd had other practices that I'd also talked to that also happened to have openings in the right time frame. But my interview or my consultation with Dr. Campbell really sealed the deal for me. When I spoke to him, he was able to talk to me about risk mitigation, which I've got an engineering degree, and I work in business. I manage these large projects, so he was able to talk to me intelligently, didn't talk down to me, and let me be a participant in my care, which I really liked, and that's what